Hi, I'm Sara, and today we're going to do IV piggyback. I have my patient's chart here. I'm going to verify that I have the patient's name, Morgan Brown, date of birth 8/4/70, MR number 589-135-1325. He has no known allergies. And I see here he has an order for ciprofloxacin 400 milligrams IV piggyback in 50 mLs every 12 hours to infuse over 60 minutes. Now I'm going to compare my physician order to my MAR. Again, I have Morgan Brown, date of birth 8/4/70, MR number 589-135-1325. He has no known allergies, and I see here he has an order for ciprofloxacin 400 milligrams in 50 mLs IV piggyback every 12 hours to infuse over 60 minutes. It's ordered today at 9 a.m. Now I need to check for compatibility because it looks like he has IV fluids running as well. So I want to make sure that my antibiotics and IV fluids are compatible. So I'm going to look in the drug book here. I see here it doesn't look like it's incompatible with 0.9 normal saline, so we're good to go. Other things I need to consider is why the patient's getting the antibiotics. So it looks like he was admitted with acute appendicitis and a UTI. He had a surgical procedure. I also want to assess for any adverse effects such as an allergic reaction like a rash, anaphylactic shock, and I want to complete a proper assessment when I go into the room. So now I'm going to gather my equipment. I need an alcohol swab, a date sticker, secondary tubing or piggyback tubing, my medication, which is the ciprofloxacin, and now I'm going to calculate my rate. Okay, so our order was for 50 mLs over an hour. And we need to calculate 2 drips per minute. Okay, so we knew that our tubing was drip factor of 10 per ml. Then we need to do 1 hour over 60 minutes. I'm going to go ahead, I can cancel out my mLs. I can cancel out my hours. I'm left with drops per minute. That gives us 500 drops over 60 minutes. 60 minutes. Then that will come out to 8 drops per minute or 2 drops in 15 seconds. Okay, now I'm going to prepare everything to go into the patient's room. So I want to complete my first check. So I have Morgan Brown, right patient. I have ciprofloxacin 50 mLs with 400 milligrams, which is the right drug and the right dose to give today at 9 a.m. via IV piggyback. Now I'm going to do my second check. I see I have Morgan Brown. I have ciprofloxacin 400 milligrams in 50 mLs to give IV piggyback today at 9 a.m. I'm inspecting my drug and it looks good. It's clear. It's not cloudy. There's no discoloration. It looks like it was prepared today. The expiration date is good, 1/10/50. So now I can prepare my medication. So you want to make sure you hold on to this blue plastic hook. We're going to need that when we go in the patient's room. You want to close the roller clamp. Now, if you notice, this tubing is a lot shorter than our previous tubing that we used for the primary line. So you have to be very careful not to race the drug because you have such a smaller volume here. So again, we want to keep this spike sterile. Pull a stopper. Spike, push, and twist. Okay, fill the drip chamber about halfway again. Okay, now I'm going to carefully prime this, again, without getting air in the tubing. Okay, looks good. I don't see any air. So now I can go ahead and get ready to go into my patient's room. I'm going to get my date sticker ready first. And again, you want to put the date sticker on the tubing and not on the drip chamber. Now I'm ready to do my third check. Morgan Brown, ciprofloxacin, 50 mLs, 400 milligrams, IV piggyback, due today at 9 a.m. Again, my medication looks good and it's not expired. So now I can get ready to go to the patient's room. I'm going to grab my medication, my MAR, the plastic hook, and an alcohol swab. Hey Morgan, it's Sara, your nurse. I'm here to give you your IV antibiotics. How you doing?
Good.
Good. Any pain?
None at all.
Okay, I need you to go ahead and verify your name and date of birth for me.
It's Morgan Brown, 8/4 of 70.
Great, that's what I have here. Morgan, do you have any allergies?
No, I do not.
No allergies to latex, iodine, or adhesive?
No.
Okay, great. So the doctors ordered some antibiotics because of your appendicitis that you came in, that inflammation in your belly, and the infection in your urine. So we're going to prepare these antibiotics so you can get feeling better.
Great.
Are you having any burning or anything at the IV site?
No, it's fine.
Okay, and it looks good. I don't see any swelling or redness. I'm going to go ahead and raise the bed again so it's at a comfortable position for me. All right, and then I need to make sure that I clamp my primary tubing. Take my plastic hook. I'm gonna put that here. We have to drop down our primary fluid. Hang my Cipro here. And again, I'm going to scrub the hub. Now I'm going to connect the secondary to this port here, closest to the primary fluids. So scrub again for 15 seconds. And I'm going to make sure that my tubing looks okay again. Everything's primed. The primary's primed, secondary's primed. There's no air. And then going to carefully connect the two together, push and screw again. Okay, good. Then I can go ahead and open up the clamp on my secondary tubing, and I'm going to control my drops with the primary roller clamp. Again, I need to be using my watch to count my drops per minute, which, if you remember, we had 2 drops per 15 seconds. Okay, it looks like we have our drops per 2 drops per 15 seconds. All right, Morgan, you're all set here. Is there anything I can get you?
I'm fine, thank you.
Are you comfortable?
Yes.
Great. I'll be back in about 15 to 30 minutes to check and make sure that that medication is infusing properly. Here's your call light. Feel free to call us if you have any pain or if you need anything. And let us know if you feel any burning at the IV site.
Okay.
I'm now going back to the nurse's station to complete my documentation. Now I'm back at the nurse's station. I'm going to document what I just completed. I gave Morgan Brown ciprofloxacin 400 milligrams and 50 mLs to infuse over an hour. Today at 9 a.m. I will date and time with my initials. I also will document that he tolerated the procedure well. There was no swelling or burning at the IV site. I will then return to the patient's room in 15 to 30 minutes to make sure that the medication is still infusing and that the patient has no complaints. I will assess the patient for adverse effects such as itching, burning, anaphylactic shock or shortness of breath, and to make sure that my IV site is still intact. This completes our skill of IV piggyback.